SDGs do we have? How many? 17. Okay, you can see we are all attentive. And out of the whole discussion that we've had, what is primary health care? Anyone? 1,000 shillings going once? Going twice? Yeah, Dr. Mugabe just mentioned it, okay? So you can quickly go and review this. So those who have come before me have said a lot about what I was intending to also talk about. But maybe I can just do a touch-up or just wrap it all up. And we just want to look at how can you as youth lead the path to strengthening primary healthcare systems, okay? So how can you go about it, all right? And usually, as with anything, it is important for you to actually train, okay? You need to have the requisite training. I think we have the requisite training, all right? Or we're in the process of acquiring it, okay? I don't know, how many students do we have here? Students? Recent graduates? You know, last time I went somewhere, they said recent graduates, I was like, then someone put my hand down, I'm like, man, you're past the years that you're allowed to actually raise your hand, okay? Sikusikia vibaya, alright? But what we are saying is that that training is important, okay? You are acquiring it in school, alright? And besides that, most importantly, the most important training that you're going to get is that which you acquire through apprenticeship, okay? You're with someone, they are planning the summit, all right? What did you learn during the planning of that summit, okay? Dr. I forgot her name, but she talked about shadowing this person who was doing a lot of KMA activities, okay? And when it came to the vote, what happened? She had too much information, all right? And you know, by default, it happened, okay? So if you want to strengthen a primary healthcare system, then it is important that you acquire the training that is required for that. Shadow someone, okay? Get a mentor, all right? We have been given some hints about how we are going to get a mentor, okay? Besides that, you also want to plan, okay? Look at this healthcare system. What is lacking in it, all right? Then, what are you going to bring? What are you going to do, okay? How will you make that healthcare system better? How will you strengthen it, all right? Anything in life, you have to plan, okay? And for you to plan, you must come up with your objectives, all right? What is it that you hope to achieve in strengthening this health system, okay? Now, once you know what it is that you hope to achieve, how are you going to achieve it, okay? Now, once you establish the what and the how, comes the hard part, okay? How are you going to explain to others your plan, all right? And whether you like it or not, you must involve people in these plans and these implementation processes, okay? And usually, people are very ready to come on board, all right? All you need to do is just pitch, okay? And they say no, and you go back home, and you revise, and you pitch again, all right? Or you improve your plan, okay? And you go ahead and implement it, all right? And most people, once they're done with the implementation, they are very happy, okay? I am done. I have strengthened the health system. I am going home for a big day's rest, okay? Unfortunately, that is not the end, okay? That is not the end. You need to look at what you have done, okay? When, if I was targeting, say, the youth or the old, okay? I want to go back and you know, just hear what they have to say, all right? Did this intervention help them, okay? And it is important for you to participate in these feedback collection mechanisms because they help us to improve the plan, all right? They help us to actually strengthen that which was not strengthened enough, okay? I don't know, did you guys see the post-COVID surveys that were going around? You see, as a digital health practitioner, I'm usually inclined to think that most, if not all youth, have a gadget and access to Wi-Fi, so to speak, all right? And the other day, I was telling someone that their gadget is a phone. I was told that iPhones and Galaxy Z series, I think, they are not phones, they are gadgets, okay? So I will safely use the word gadgets and say it is an expectation that almost all of you have gadgets, okay? And here today we have free Wi-Fi, all right? So when this survey went out, did you take a minute to look at it? Do you think if you took this survey, you'd have made it better or easier for us to make the system work for you? Do you think so? So whether you're coming from the implementer's point of view, the implementer's angle, or whether you're coming from the recipient's angle, okay? We are both in a position to strengthen our health system, all right? And the reason why our focus right now is especially on the youth is because you make the largest proportion of our population, okay? In Kenya, so to speak. So what proportion does the youth make in Kenya? What proportion of the population? 5,000 shillings going once. Come on guys, what proportion? 70%? All in agreement say aye? Nays? Those who are not sure? Alright? So we make a significant percentage, and therefore I always like to encourage us that when you see a survey, alright, do it. Okay? Maybe your uncle, your church is not able to, they can't even see the two buttons on the phone, you know, or they prefer that phone with the buttons, the Kamuis that does not have Wi-Fi connection. How about you go to them, you collect this information and feed it on their behalf, all right? We need that data, okay? And usually we also like to encourage you that as you implement something, as you try to strengthen something, all right, it is important that you use the evidence that you have available, okay? Reason being, if you did your work properly, after implementation you collected the data, okay? And you are like, this will not work for the old people. Using TikTok, when I'm targeting 60-year-olds will not work, okay? How many of you are on TikTok? I'll not judge. All right? So you see, if I wanted to target you, I can go on TikTok. It will work. All right? If I'm targeting 60-year-olds, maybe I can go on radio, especially the ones with the local dialects. It will work. Okay? And once these people do their job and they, you know, do a publication or something like that, all this information is out there. You can actually go read the research that someone did and you see, this data might be biased because they reached out to the old people using TikTok, all right? Let me use the radio. Let me see if I'll be able to collect better data, okay? So it is very, very important that you look at the evidence base and you use it to inform your plan. You use it to inform your implementation, okay? And that is how you as youth can impact and strengthen this primary healthcare system, okay? That healthcare system that reaches directly to someone, all right? Other than that, we are looking at, once you have impacted this healthcare system, okay, how do you make it sustainable, all right? Well, a lot was said, blah, 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 and then they say, I work at place X, all right? Maybe something happens and I decide to go and work at place Y, okay? So when I was working at place X, I had this whole plan, I implemented it, all right? But I'm leaving place X, okay? What assures me that this plan will keep working, all right? What assures me that that plan is sustainable, okay? I don't know if this example would be appropriate. I like to give this example of the FGM campaign. How many of you were there when the FGM campaign was started? I'm old. So this guy started the FGM campaign. It was not peaking. Years down the line, people were still doing FGM. Oh, they went back. They realized maybe the approach was not right. You know, they were talking to the women, telling them don't go for FGM. All right. Unfortunately, in some areas, the decision makers are the man of the house, okay? So when they changed their approach, they started talking to the men, they realized that, when they understand it, they actually tell their daughters not to go for FGM. The plan started working. Okay? Now, the question is, once you have lowered the FGM rates, or people are about 2% are still doing the FGM, maybe you think that is fair, okay? How do you sustain it at 2%, all right? Or how do you lower it to 1%, okay? You have now moved, you are no longer working in the FGM campaign, you're working in the TV campaign. Someone else was hired, working there. How do you make sure that this person is able to follow in your footsteps? Okay? So as much as you're developing a plan to strengthen a health system, it is also important for you to develop a plan to sustain that healthcare system. Okay? And usually this is a sustainability plan. It is only developed by listening to what the environment is telling you. Okay? Just go back, ask these people, do you like this plan? Alright? What do you think we should do? Maybe in our meetings we should have like a small, I was told this local brew is called Kalovo or Muratina. We come with a little Muratina. Do you think that's a plan? You come with Muratina the first day, you get 5 more people, you get 20 more people, and you keep going, all right? Ask the people. The only way you have a sustainable plan is if you have a plan that works for the community and a plan that is adaptable. It changes with time, okay? Well, during those times we used to call people to a baraza, tell them to attend an FGM, okay? Well, nowadays, some of them have got televisions, all right? We can go on TV and say, anti-FGM campaign, all right? And you know, their kids are now on campus, they have bought phones. You can go on TikTok and start an anti-FGM campaign, okay? This sustainability plan has to change with the environment. Don't we agree? Right? You guys were there during the HIV campaign when it started. Alright? We used to paint buildings, showing people, you know, to me a condom, ukoshua, blah blah blah. Okay? But nowadays what happened? Do you guys know that Chukua selfie song? We know it? We changed our ways. Okay? The youth are most affected. How do we reach the youth? We tell calligraph, unajua nini? Kuja washtue. Alright? So have a sustainability plan that is adaptable. And lastly, when you look at financing this plan that you want to implement, there are many ways that have been talked about, okay? I will not repeat them, but when we are looking at financing, it is important for you to consider forming youth-led communities, all right? Right culture is one of them, okay? Form a community, all right? Tell people this is our plan, okay? I like to give an example. When you want to eat groundnuts, you go to the vendor and say, "Njugu anaksho, in njugu ni 150 bob." You don't have 150 shillings. What do? You look for some friends. Now, and you say, "I'm still kula njugu leo break. I'm still kula njugu." You get 10 people. Wanataka kula njugu. Si ndio? Mmoja akona 10 bob, mwingine akona 20 bob, mwingine akona 5 bob. Aki inafika 150. What happens? You buy the njugu and then mnagawana. Si ndio? That's exactly what is going to happen when you form these strong youth associations, okay? People are going to bring in their resources, you distribute your resources, and you are able to propagate your agenda. Other than that, you're also looking at stakeholder mobilization, okay? People are so keen on the youth, all right? You just need to put yourself out there, okay? Who is interested in health among the youth, all right? You have the Ministry of Health, okay? Muko wengi. Ukisema unataka kuwa community health worker, mbio, Dr. Mugambi anakuchukua, unamsort pale Maimahi. Si ndio? Alright? Ukisema you want to do ABCD, people are ready, people are willing. You have the ideas, you have the training, okay? So you also have Ministry of Youth Affairs. There are so many ministries, so many NGOs that are keen on the youth agenda. Okay? So whenever you want to implement a plan, you want to strengthen something, look at who are interested in what I'm doing. Who are the stakeholders in this space? the hardest job in the world. Okay? You will have made the world a better place. Alright? So again, I will not repeat much of what was said. It was just a quick brief. Plug in as the youth. Use the advantage of being a youth. Okay? Personally, my hand is always put down and I raise my hand as a youth, but I'm still there, almost out. Alright? Consider developing a plan that will last even when you leave. Alright? When you're 60, when you're 70, your plan is still working. Okay? And always harness sustainable